Welcome back to Joy in Our Town. I'm your host, Nick Kroger, and as promised, we've kept the team of Clark & Clark doctors here. We heard a little bit from Danielle, Dr. Danielle, about pregnant women and infant care, which was amazing and enlightening. But we're going to give Dr. Roy a chance to talk a little bit about the chiropractic treatments, the benefits of it, and as they pertain to accidents and auto accidents. I'm going to ask the question because, you know, whenever you think of accident, the first person everyone thinks of is that attorney, you know, because you see all those crazy commercials. But chiropractic care, I think, is probably the first call someone should make. Do you really need to seek out chiropractic care following an auto accident? And why is that so important relatively soon after you've had that accident?
Well, I mean, depending on the accident,
right?
You know, I mean, if it's something severe, your first stop's going to be the hospital,
right?
You're going to go to the emergency room, and that's their thing to treat emergencies. You know, they're going to be looking for the broken bones or any cuts or bleeding, internal bleeding, swelling of the brain, anything like that, and then that's what they're going to treat.
Right.
Other people might. You know, they might not even feel pain right away, and so they'll just kind of wait it out, and maybe a couple days goes by, they start to get some back pain or something like that. So they go to their family physician, and they give them some medication, which will help dull the pain. But many people will also go see a chiropractor, and the chiropractor is good at finding those hidden injuries. Sometimes, like I said, you might not have pain,
right?
But that doesn't mean that there's not something going on. That if left untreated, later on down the road could present itself and actually cause chronic pain for years to come. So that's where the chiropractor comes in to find those hidden injuries, right. But they're also good at treating the acute pain as well, so you don't have to rely on drugs, medication, anything like that. Anymore, there's a lot of new law changes going on as well, whereas before there wasn't really a time limit as far as where to go to seek care.
Okay.
But now I think it's 14 days after an accident. If you don't seek treatment within 14 days, then you might not get those benefits anymore. So now it's actually a little more important as far as, you know, seeking care is concerned. It puts a little more
urgency on
urgency,
it. Yeah.
exactly, yeah.
Well, I would imagine, you know, you mentioned, you know, they might not feel pain right away, and just you know, anytime you're in an accident, and this is me reliving it in my head, you know, that body tenses,
right.
and to almost instinctually to protect yourself,
right.
And that sometimes doesn't put you in the best position for an impact or a car accident. And I imagine a lot of that tension resides in here, where you're saying some of the hidden damages. Talk to me a little bit about hidden injuries. I know that, you know, when we were talking about the pregnant woman, we were showing this bone out and that bone out.
Right.
But how the smallest, you know, movement can then manifest itself, even if it's at a later date, in a bigger problem.
Right, right. Well, I mean, you're spot on with the. You get into an accident, your body just kind of tenses up like this. In the beginning, you might not feel pain because something traumatic just happened, and you're in this fight or flight syndrome.
Right.
You got all this hormones running through you, which kind of act like a natural painkiller. So you don't really feel too much, but it's later on that this stuff sets in. But whether it was a bad accident or not, there's research out there showing that even 5 miles an hour is enough to kind of put these bones out of place here and cause that subluxation. So with that, that's where we're seeing these hidden injuries here, that even something minor where this bone is out of place, it might cause a little pressure on that nerve that can lead to your back pains or your headaches, stuff like that. But left untreated, that's when it starts to actually get worse, because over time that will start to get worse and worse and worse, and your body starts to go through these changes, and it can actually cause degeneration, arthritis, stuff like that later on down the road.
Okay. So that was my next question that we kind of just touched on there was, you know, if left untreated, does the body start to accommodate that misalignment, and which can manifest in additional problems?
Right, right, exactly. So even if like the bone's twisted out of place, that can get worse over time. Or if you were in the accident and all these muscles tightened up, something that's common to happen is that it will actually pull these normal curves out. So it'll affect the spine more globally as opposed to just like one segment. And if something like that happens, again, if it's not corrected, then your body starts to kind of adapt to these abnormal alignments, and that's when things start to get worse over time.
And that was going to be one of my next questions that I hesitated asking, because whenever you ask what's the most common, you know, nothing's the same. You know, every injury is unique. But is there, with the typical fender bender type of thing where, you know, we hear whiplash and all these, is there a common place that's affected in those type of accidents?
The most common areas are probably your neck and your back.
Okay.
And why these areas are so important too is because there's a lot of nerves that come out through here. There's a lot of nerves that come out through here. And so all these nerves, they'll run down into your arms, the shoulders, stuff like that. Same thing with the back. They all run down into your legs.
Yeah.
So it might not present as just back pain, but it might be back pain and leg pain or something like that. And it's all because of what's going on right here.
So there's a root,
right,
to find the root issue
Exactly.
that may have manifested in 3 different ways.
Exactly.
Okay.
Yep. And the whiplash, that's another pretty common injury depending on the accident.
Tell me what whiplash really is from your side of the table.
Whiplash it's basically if you're sitting in the car and you've been rear-ended or you're hit head-on, what happens is your head kind of goes through this motion right here where you rock back and forth. And when that happens, all these tendons and ligaments that hold everything together nice and tight, they become kind of stretched, and now they're damaged and injured. And when that happens, it becomes loose. And so now there's this abnormal movement with these bones. And we can actually see that with an x-ray. We'll take pictures where you're flexing your head forwards and backwards. And if you see these bones shift forward like that, that's that typical presentation of like a whiplash injury. And so that's something that that we see fairly commonly.
Now, for the person sitting at home that's just asking, you know, why can't I just rest and take my medications that were prescribed, which some people may need those after an auto, accident. Should you wait until the pain is gone, or when is a good time frame? I mean, to me, sometimes it sounds like you're going to have injury that you don't even know you have.
Right, right. And medication is good to help dull the pain, but it's not fixing the problem.
Right.
There's, again, research out there showing that people who start chiropractic care early on have better outcomes later on. So the earlier you start treatment, the better, because you are addressing the root cause of the problem as opposed to just kind of treating the symptoms, covering the pain up, and letting your body try to heal on its own. Your body will heal, but if it doesn't heal properly, then you're going to have issues later on.
Right, and the body will accommodate the misalignment if it's not corrected.
Right.
Okay.
Right.
That's good to know. Now, I think people watching are thinking, well, I'll just go in for a treatment. But sometimes it's a series of treatments, and for those people watching, explain why that is sometimes, why more than one would be necessary.
Yeah, and now again, depending on the severity of the accident,
Right.
You might just come in for a couple treatments, you might be there for a couple weeks, a couple months, it just depends. And basically what we're trying to do is heal the body. And so we're working on the muscles, we're working on the alignment of the bones, and when you've been in an accident, everything, like you said earlier, just kind of tightens up like this. And so we're trying to relax those muscles again, and we're trying to retrain these bones to line up the way that they should after they've been shifted traumatically like this.
And does it take several treatments sometimes to get, an actual bone into place, or is it several treatments to get this, and then where it's affected other things like dominoes? Right.
Well, you could, if there's, say, one area that's misaligned, it might go back with one adjustment. It might take several adjustments. And so that's kind of where the treatment is there. But it also, because of the trauma that the body went through, it may not hold that position very well. So you could be walking down the road later on that night after getting an adjustment. You step off a curb wrong, and it kind of just goes right back out again. So that's why typically we'll kind of see you for a little bit in the beginning, just to make sure that everything stays where it should. That way your body can kind of heal the way that it should.
And talk to me a little bit, I'm loaded with questions, by the way. This is very interesting to me. In between each of the bones here is, the clear stuff represents?
The disc. It's an intervertebral disc.
And if left untreated, I'm assuming the positioning is created in a way that's supposed to function just right. It causes the discs to bulge, or?
Well, if left untreated over time, it can cause these discs to degenerate,
Okay.
which will start to thin.
Thin out, okay.
And then it will actually, by thinning, it'll close these holes down, put more pressure onto the nerve there.
Okay.
But typically with an accident, like with a trauma, it will put stress onto those discs that can cause a disc bulge or a disc herniation. And that's kind of what we're seeing right here, where this kind of red piece is just sticking out. And that is going to, again, push on that area where that nerve is coming out at.
All right.
So that's why people with disc bulges are going to have back pain or maybe pain down into the leg because of the nerve that it's affecting there. So again, whatever nerve's being irritated, that's where you're going to start to feel that pain.
So it's amazing. Now, let me ask you this: in an accident, you're with a couple kids, and should only the driver be treated, or should you be concerned also about some of the passengers that were in the car for treatment as well?
Everybody in the car should be checked out.
Okay.
The driver more often will actually have less damage than a passenger. Because the driver is going to be bracing a little bit more. The passenger may be like reclining in the seat or looking in the back or something like that. We're in this kind of weird position that then when they get into that accident, they're thrown forward or sideways or what have you. So they actually may sustain more injury than the driver who's aware and kind of bracing a little bit more. Same thing like with kids.
And with children, although they're in car seats and there's supposed to be adequate support with them, they don't have the musculature like adults have to hold the bones into place. So a lot of times they'll have injuries, and like we talked about before, they can't tell you what's wrong.
Right.
But they have injuries because the muscles can't hold things or hold the spine correctly.
Right.
So although the car seats on the support around them and behind them, if it's not installed properly, or if it's reused after an accident because you can't reuse car seats after that, or you got it used or anything like that, it just doesn't have the proper support for their bodies.
And a child that possibly was in an accident, and like you said, had a hidden injury, that may not manifest itself greatly. Over time, even as they continue to develop structurally, that can have an effect, can it not?
Absolutely. I mean, just one bone slightly out of place, as a child grows up, can cause scoliosis. And, that's of course, down the road, but, their decreased function just throughout their whole body.
It's been amazing. We need to have you come back because I have lots more questions and give me a treatment on the air to see how bad my back really is. No, it's really been amazing. I think it's been great information, from everything from accidents, which people are always concerned about when you live in any metropolitan type city and the traffic we endure, but fascinating from a fertility standpoint and a pregnancy duration standpoint. So thank you so much for being here and for all the great information. And
thanks for having us.
We will have you back. And viewers, I hope that you've learned a few things. I hope that if you're a pregnant woman or someone trying to get pregnant, or you have a young infant, or those of us that have been in accidents, that you can take some of the information you've learned today and just increase in knowledge, but maybe go get a treatment and make sure that everything is taken care of and that you're in perfect alignment. And just remember, if we take all the information we gather, we can link arms together and we can all spread a little bit of joy in our town. We'll see you again real soon.